Hi, this is Dr. Jason Acevedo here today to talk to you about tonsillectomy and adenoidectomy. This is a very common procedure performed in both children and adults. In this short video, we'll just describe the procedure, the postoperative course for you or your loved one, to kind of help answer some of the questions you may have. So for children, tonsils and adenoids are often removed due to obstructive sleep issues or for recurrent strep throat. Either way, it is very safe, it's a very quick procedure. It takes typically 20 to 25 minutes, sometimes performed in conjunction with other procedures such as ear tubes or turbinate reductions. And for the vast majority of children, they will go home afterwards. Some kiddos, if they're on the younger side, or if there are medical concerns, sometimes we'll keep them overnight. But for the most part, you can expect your child will be able to go home that day. The way it's performed in children, very similar to adults, is general anesthesia, where your child will be given a laughing gas. Once they're asleep, an IV is started, a breathing tube is placed to give them oxygen, and then I go through the mouth using a little device to open their mouth, remove the tonsils, remove the adenoids, ensure there's no bleeding. And then once they're done with surgery, they're woken up, taken to the recovery room where they stay for anywhere from 30 minutes to an hour until I know that they're drinking okay, that they're not having any nausea, any pain, any issues such as that. And then they can be discharged home. Afterwards, I will keep them on a very soft diet for the first week to 10 days. Meaning nothing spicy, nothing crunchy, lots of ice cream, popsicles, jello, pudding, things of that nature. Slowly advancing back toward a normal diet. Things like macaroni and cheese can be okay that first day, mashed potatoes, soups and broths, soft foods, anything you can imagine would be easy to get down. And as far as liquids, you really want to focus on hydration because after tonsillectomy and adenoidectomy, it's very easy to get dehydrated because you'll have a sore throat. You're not really too interested in drinking, so you really have to be sure your child is taking in plenty of fluids. And water is great, sports drinks, dairy is okay. You do want to avoid things that are acidic or carbonated, so lemonade, orange juice, pineapple juice, soft drinks. I would steer clear of those because they can cause some pain in the throat. And very similarly with adults. Adults, it's going to be a very similar regimen, general anesthesia, 20 to 30 minute procedure. The biggest difference would be in the length of recovery. Kids tend to bounce back pretty quickly. Adults typically need a little bit more time. So the diet's very similar for both adults and children. One of the differences may be in pain medication. For children 4 or under, we typically avoid narcotic pain medicines. And what we would do is rotate Motrin and Tylenol in the liquid form. And for the first few days, regardless of whether the child's having any pain, I would recommend giving it every 3 hours, just rotating that Tylenol and Motrin. For older children and adults, we still use the liquid Motrin, but instead of the Tylenol, we'd use a narcotic pain medicine, typically hydrocodone with Tylenol in a liquid form. But keeping that same rotation, Motrin, 3 hours later, hydrocodone, 3 hours later, Motrin again. Occasionally, too, in adults, we will also add a compounded numbing medication that can be used as needed every 2 to 3 hours to gargle and spit to help with that additional pain in between the doses of the pain medication. Activity-wise, you will want to restrict the activity after a tonsillectomy and adenoidectomy. In children, that typically equates to no school for the better part of a week, no vigorous physical activity like sports, working out, things like that. Same for adults. Wouldn't want you to go into the gym or doing any heavy lifting. Some patients are able to go back to work prior to a week if their work does not entail a lot of heavy lifting or anything physical of that nature, if it's office type work. But you will be on some pretty strong pain medicine, so you just have to be sure that cognitively you're able to do your daily tasks. As far as complications of surgery, every surgery has risks and complications. Tonsillectomy is a very safe procedure, same as adenoidectomy. The biggest complication we typically I wouldn't even say worry about, but mention to patients is bleeding. And bleeding is rare. 3 to 5% of both children and adults can have some bleeding afterwards, and it's not typically life-threatening or severe bleeding, but it is important to keep an eye on. And if you see a blood clot or a little bit of bloody saliva one time, goes away, no big deal. If it's persistent, or if it's a large amount, say your child or you, if you're the patient, is doing great, and then a week after surgery you vomit and there's bright red blood in it, or if you start coughing, spitting, there's blood in it, it's persistent, it doesn't stop, you do want to call the office, and the on-call doctor will let you know how to proceed. Sometimes it stops on its own. Sometimes we would have you come to the emergency department so we could check it out. Kind of depends patient by patient, but the key is just to recognize it, call the office, and let the physician on call, who may be me, decide how we proceed. So hopefully that's given you some good information. The diet, the pain medication, hydration is key. If the patient afterwards is starting to run fever in the first few days, it's very rare to be infection. More commonly, it's dehydration. So just make sure, whether it's you or your child is the patient, keep them really well hydrated. And even if they start running a low-grade fever, just really push the fluids. And if it doesn't clear up, call the office and let me know. But hopefully that's been helpful. And it's never a fun recovery, but patients will tell you once those tonsils and adenoids are gone, better sleeping, better breathing, and no more infections. So a little short-term pain for a long-term gain. Thank you.